Pakikinggan ang bawat panig.
When you fight for justice, think about the queer people.
Kung hindi kami magkukwento, sino ang magkukwento para sa amin?
Ang mga panawagan, ipababatid.
Hindi talaga ito masusing pinag-aralan ng gobyerno.
The women who are beaten and abused. It's time to listen to their voices.
Tunghayan ang iba't ibang boses. Mga kwento mula sa iba't ibang anggulo. Dito lang sa Point of View. Sa usapin ng mental health, madaling sabihing mahina ang loob o nasa utak lang ang problema. Kaya ang mga nakararanas ng mental health concerns, kundi mag-isa itong pinagdaraanan, ay tahimik na nakikipaglaban dito. Pero ang mental health ay hindi lamang usapin ng mga bumabalot sa isipan. Ito ay emosyonal, panlipunat at maski pinansyal. Madalas resulta ng sistemang umiiral sa ating kapaligiran, maging sa ating bansa. Eksploitasyon sa trabaho, pressure ng social media at walang katapusang siklo ng kahirapan. Paano ba natin ito tinutugunan bilang isang lipunan at bilang isang bansa? Ako si Rose Babiera at ito ang Point of View. Isa sa mga aspeto sa usapin ng mental health ay ang affordability at accessibility ng mga mental health services. At para tulungan tayong unawain ito, makakasama natin sa talakayan ngayong araw ang National Chairperson of Youth for Mental Health Coalition, si Ms. Ray Aliana Lagasca. Ms. Aliana, magandang tanghali po and welcome po sa ating programa.
Sa mapagpalayang araw po, Ms. Rose, no? At maraming salamat po para sa oportunidad na mapag-usapan natin ang kalusugang pangkaisipan.
Bago po tayo dumako sa iba't ibang usapin sakop nitong mental health discussion, gusto ko lang pong malaman what brought you to be a mental health advocate bago po kayo nagsimula na ngayon striding for changes in policies and creating different efforts. Ano po ba yung nagtulak sa inyo para maging isang mental health advocate?
Ms. Rose, kinilig naman ako dun sa tanong mo, no? Kasi kadalasan kapag kami ay pumupunta sa mga talakayan na katulad nito ay hindi naman ito tinatanong, no? Pero ako personally, I'm a person with lived experience. So I was diagnosed with a mental health disorder way back in 2010. And it was, of course, a very taboo topic pa, no? An elephant in the room way back that time. At ngayon, marami na yung certain changes na nangyari sa ating society and even the policies are new. The policies are different at this particular time at mas napag-uusapan na ito ngayon. Pero definitely, noong 2010, nung ako ay nasa teenage years ko pa, hindi naman ito bukas na napag-uusapan. Kaya naman ito ay naging mahirap, no, para sa akin. That's why throughout the years, no, we established Youth for Mental Health Coalition way back in 2016 and now it's been 9 years. Ang goal talaga namin is hopefully yung aming experiences from the past will not be the same experiences of young people today. So yun yung mga siguro masasabi ko personal na tumulak sa amin to actually start the organization and of course this advocacy.
Ayan, nanggagaling po tayo dun sa personal na karanasan at saka kalagayan, which I think make you really credible for this discussion. Ngayon po, we'll go directly to this conversation, lalo na in the context of the Philippines. Kasi syempre, ang dami pong nangyayari sa ating bansa nitong mga nakaraang buwan. And kakatapos lang po ng Mental Health Awareness Month. And lately, this past few weeks, it has also brought to the focal point of discussion once again. In terms of data, ano po ba yung, what are we dealing with dito sa ating bansa? Gaano na po ba karami yung kaso? And like, how do we monitor these cases?
Yeah, actually, Ms. Rose, no, unfortunately, there are very few research studies conducted for mental health, no. But there's a specific study, we call it the National Survey on Mental Health and Well-being. It was conducted way back during the pandemic, but it was published earlier this year. And this particular study is actually share to us, no, na malaki yung prevalence among young people, no, and there is an increasing number of suicide cases as well. Nakapanlumo kasi definitely, no, I mean 7 years after the law was actually passed, problem pa rin natin ito, no. It should have been, some kind addressed along the way. But the concerns on registries and other information about mental health conditions is still a problem here in our country. But definitely, no, marami din naman mga institutions and even civil society organizations are actually working towards providing specific kind of care para din ma-address natin yung mga ganitong concerns. However, we need the data, we need the information.
Yeah, striking nga po yun sa akin, especially, syempre tayo po inaaral natin yung iba't ibang impormasyon na meron tayo, regardless of the sources, kung online man yan or physical man. Yung mga policies po dito nakasandig eh. Ito yung pundasyon ng paggawa ng polisiya, kung akma ba o tama. Especially generational wise. Kasi sabi nyo nga po, 10 years ago, hindi madalas pinag-uusapan as ang kalagayan na nito kasi iba-iba po. So talagang mahalaga yung kung meron tayong data for us to monitor kung tumataas ba. Like, ano po ba yung mga markers, di ba? Kung may mga ganun po. Now, since we don't have that data, pag-usapan na lang po natin, ano po ba yung mga major causes ng mga mental health concerns sa Pilipinas, including the youth, kung saan nakita po natin yung mataas na bilang ng mga kaso?
Yeah, just for example, no, during the time of the pandemic, marami yung mga kabataan na tumawag sa National Center for Mental Health Crisis Hotline, and there are major concerns about relationships, about their academics, and even in workplaces. But also, there were calls about seeking help, no? Saan ba sila pwede magtungo para humingi ng tulong, etc. Kaya hindi natin masasabi na yung growing number of calls doon sa crisis hotline ay dahil lang sa merong specific grave or di kaaya-ayang nangyari sa kanilang buhay, but also because more people now are actually seeking help, no? So meron na tayong help-seeking and health-seeking behavior. But in the course of our specific informal studies, no, at least sa organization namin, marami talaga yung may concerns about their relationships. So hindi lamang ito about romantic relationships, but more on family relationships. Very complex din kasi ang Filipino family relationships. And then apart from that, of course, for younger people, maybe the workplace, if they are young members of the workforce, baka nahihirapan sila mag-adapt, no, doon sa changing landscape also in the world of work. And pwede din na yung academics are actually being, masyado silang nahihirapan, no, in actually getting higher grades, which is definitely the expectation of, again, the family. So, in conclusion, no, kung susumahin talaga natin ito, no, marami talaga yung mga certain factors affecting the mental health of one young person. But I would also say that social media has played a very big role, no, in the mental health of young people. Especially because sa social media, there are a lot of news, credible information, and even fake news, no? And the socioeconomic factors definitely affect one person's emotional status.
Most of these things and causes that you've just mentioned, nakadirekta po siya mostly sa mga kabataan. But do we have like data on adult kung bakit sila nakaka-experience din sa ating bansa? Adding the recent events that happened in our country, may mga disasters po tayo na kinaharap. Does that also add up to the reasons?
Pwede din po, no? But again, yung studies that I shared earlier also said na amongst older generations, no, yung feelings din of loneliness is actually part kung bakit sila nagkakaroon ng mental health condition, kasi the studies actually show na those who are with no partners or no family members, no close friends, and even those who are living alone, no, especially in urban areas, meron silang higher prevalence of a mental health condition. So that actually really shows na sa usapin ng mental health, hindi lang siya about the clinical part, but also the societal part. Kasi kinakailangan talaga yung relationships with other people are strong enough, no, because we all need a support system.
Yes. In terms of, sabi niyo nga po kanina, 10 years ago or even more than that, when you were dealing it yourself, hindi pa siya ganon. It's a taboo, hindi pa madalas pag-usapan. Pero eventually, it is being put into major discussions. But as we go on, ano po ba yung mga kinaharap nating misconceptions with mental health? And pwede po ba nating patunayan na hindi ito yan at ito ang totoong imahe noon?
Well, una sa lahat, nandun pa rin yung stigma. Actually, kapag pumupunta kami sa mga rural areas, and even sa mga highly populated areas, when we talk about mental health, ang una ko talagang tinatanong ay kung ano yung kanilang pananaw patungkol dito. At karamihan sa kanila, ang unang naisip is about mental health conditions. Some others say na, Ate Yana, yan ba yung may mga baliw, may saltik and all that. And ito pa rin yung conception, ito pa rin yung pananaw ng karamihan. Hindi naman siguro karamihan, but those who haven't had the chance to learn about it or understand it better. And itong stigma na ito ang nagdadala sa atin ng discrimination. No? And the sad part about it is that ang mental health ay estado ng ating kaginhawaan and kagalingan. So, ibig sabihin it's a very positive component of our lives. But if it's seen negatively, then iba din yung messaging na masasagap ng mga mamamayan and maaaring dahil negative yung messaging na kanilang nakuha, pwedeng ma-neglect natin yung mental health natin in the process. That's why yung mga misconceptions na ganito, katulad ng ang mental health ay equal to a mental health condition, di naman kaya ang mental health ay kapag meron kang mental health condition, hindi ka na pwedeng maging productive, hindi ka na pwedeng mag-function or mag-flourish, hindi ka na pwedeng mag-thrive. No? Ang mental health ay isang parang kapag nagkaroon ka ng mental health condition ay katapusan na ng lahat. No? It's not like that. No? There are ways on how we can manage our mental health conditions, and definitely nakapaloob dito yung preventive measures and even yung responsive na measures. And on top of all that is the care that you get from yourself and from the people around you. At the same time, gusto kong i-highlight na isa din sa mga pinakamalaking misconceptions na na-experience natin is yung pag-uusap daw patungkol sa suicide will actually lead to a suicidal event. I want us to think very clearly and very deeply about this particular topic, dahil sa aming mga pag-aaral, even sa mga pag-susuri na ginawa ng WHO and other institutions, na mahalaga talaga mapag-usapan ng suicide for us to prevent it. But the thing is, the manner on how we actually discuss it matters. Kaya talaga, let's avoid romanticizing suicide.
Healthy conversation.
Healthy conversation, exactly, Ms. Rose.
Even sa mga growing, lalo na yung mga kabataan na nabubuo din yung mga values nila growing up, na doon pa lang nagsisimula na yung mga ganito. Mabigat man ang mga conversation, pero necessary na maging bukas yung isipan ng mga bawat isa.
Definitely.
In terms of response naman po, ibabalik natin yung konteksto dito sa Pilipinas. How are we progressing? Definitely there is progress in terms of discussion. But how are we progressing in terms of providing mental health services? Ano po ba yung general na kalagayan before we go into the specifics of discussing various laws? What is the general approach the Philippines is taking now when it comes to providing mental health services to our people?
Yeah, Ms. Rose, we have to be proud of other cities and barangays, na meron ng mga mental health ordinances. So, ibig sabihin, meron din silang services that they can actually provide to their constituents. At isa ito sa mga pinakamahalaga actually, yung on the level ng pinakamalapit sa'yo o yung iyong komunidad, ay meron ka na kaagad tulong na makukuha. That's why we give our salute sa mga local chief executives talaga na prioritize ito among any other or all other problems na highlighted sa kanilang constituency. But I would actually say that there are particular programs in place. There's this the Medicine Access Program, which provides yung mga service users free medication. There's also, of course, nakaangkla sa mga certain na batas natin, no, na magkaroon ng mga facilities available for mental health services. Merong mga positions in certain public hospitals for mental health professionals. Meron din tayo mga certain programa about having guidance associates and guidance counselors in schools para on that particular level, ma-prevent na natin yung onset of a mental health condition. And ang pinaka masaya siguro sa lahat ng ito, no, is patuloy pa yung pag-improve ng services na napoprovide. But of course, there are particular gaps, and siguro yung malaking question is 7 years old na yung RA 11036. Malaki na ba even yung naging progression natin from the point na pinaglalaban lang namin or isinusulat namin yung laman ng batas to where we are right now, no? We would say na marami na yung progress, no? Pero to what extent are we waiting for para hindi pa natin fully ma-implement yung law is the question.
You mentioned about implementation. Those things that you mentioned, yun po yung mga parang serbisyo mula sa gobyerno at saka mga effort ng mga people in power, of course, kasi sila ang may kakayahan na mag-allocate ng mga pondo sa mga bagay na ito. But in terms of like receiving these services, nasan po ba tayo in terms of that? Are the people in the stage na kailangan pa nila ng awareness or readily available naman yung help pero hindi nakakarating talaga sila? Where are the people in that regard?
I would say that we have to improve, no, yung ating dissemination of information. Kasi maaaring ang mga serbisyong ito ay libre mong makukuha sa mga iba't ibang lugar, pero hindi naman natin alam kung nasaan ang mga ito, then that would be a problem. Though I would say that people nowadays ay meron ng help-seeking behaviors.
Active na yung
no?
behavior.
And marami ka din makikita even on online spaces, no, requesting for support or asking where they can seek support. So that's a good thing, no? Kasi ibig sabihin nun, alam nila that they actually need help, and seeking help is an actual strength, no, rather than a weakness. And ito yung lagi naming sinasabi sa mga service user or sa audience namin, no, that learning that you need the help from someone is actually a sign of strength, no?
Yes,
Kasi ang hirap kayong i-acknowledge, no, na kinakailangan mo ng tulong. Kaya naman, you always tell them, okay, so ito po yung mga pwede niyong paghinga ng tulong, no, in times of crisis, and when that time comes na kinakailangan niyo na po talaga ng support na makukuha from mental health professionals. But the thing is really, ay dahil sa alam na ng mga tao kung saan hihingi ng tulong, then definitely dumadami yung taong humihingi ng tulong. And the problem there is, kakaunti lang yung mental health professionals natin sa bansa.
To cater to everyone. Now, let's go to that law that you just mentioned. 2018, yung RA 11036, which is our Mental Health Act. Too late for a country. Ito po kasing mental health, hindi mo naman siya masabi, nagsimula lang siya ng gantong era or gantong panahon. It has been there, hindi lang nga na pag-uusapan. And it took us until 2018 to finally craft a law that caters to the mental health needs of our people. 7 years, ano po ba, una po, ano po ba yung kinikilala? At saka ano po ba yung tinutugunan nitong Mental Health Act na meron tayo?
Of course, the Mental Health Act is actually rooted dun sa ating right to health, no? O sa ating human rights, kumbaga. So it's a rights-based law, and definitely yung paggawa dito, it was inclusive and participatory. So humingi talaga ng insights from people with lived experience, their caregivers, and other members of the society, no, na merong rightful and relevant opinion and insight about this particular law. Inaalagaan nito yung karapatan ng service users, ng kanilang pamilya, but also provide some sort of protection, no, doon sa ating mental health professionals. Kasi yung services ay definitely kinakailangan maging rights-based and humane. No? So there are some penal provisions kapag merong discrimination na nangyari and even if kapag yung service na pinrovide ay hindi humane enough, no. Actually, ito yung lagi namin sinasabi sa audience namin is to read about the law because it provides you with your rights and you would know kung saan kayo hingi ng tulong at kung nava-violate na ba yung karapatang pantao mo. So, it's a good law, no? But definitely there are some gaps even na nakita natin throughout the years. But they are supplemented by different guidelines and frameworks now that we have dahil very progressive and very active din naman yung Philippine Council for Mental Health in creating different guidelines and frameworks.
Ito pong mental health law, sino po bang kinikater nito? At kasi for a lot of people, they will say na these are only for people who has mental health issues. Tama po ba yun? Or
No, it's for everyone. No. Again, when we talk about mental health, hindi lang siya doon sa presence ng mental health condition, no? But it's our holistic wellness. So, pangkalahatan, nakalusugan talaga. So, it also provides, RA 11036 also provides us with different opportunities so we can prevent the onset of a mental health condition. So, yung preventive measures in the workplace, in the school, and even in our communities ay nakapaloob din doon sa RA 11036. So, hindi lamang siya para sa service users, no? But definitely it protects the rights of service users. And it gives more protection to the dignity of families also and caregivers and protects yung iba pang rights din ng mental health professionals. But it's for everyone.
I think isa po yun sa mga bagay na magandang malinaw kasi ang alam po ng marami yun nga po, yung tingin nila sa mental health is kapag may pinagdadaanan mo na siya. Whereas there are preventive measures such as what the law can provide and give. Ito, isa po sa mga bagay na hina-highlight dun sa batas. Katulad nyo nga po nang nabanggit nyo kanina, na meron na yung mga ordinances na mas pinalakas or pinaigting ng mga ordinances sa bawat lungsod ay yung pagkakaroon ng mga help desk, mental health assistance. Minamandato po ng batas na magkaroon ng ganito ang bawat lungsod.
Well, yes, it does.
It mandates that.
Yes.
And of course, unfortunately, this country has a problem with implementation of the law, kaya hindi natin nakikita. But in an ideal full implementation of this law, how does that look? Dapat ang bawat barangay po ba ay mayroong?
Yeah, that's the goal, no? Basically also because the DILG is actually part of the Philippine Council for Mental Health. So, right now, there are, ayon po no, kay DILG, ay marami na rin naman pong cities and barangays na mayroong ordinance patungkol sa mental health. No? And the ordinance ang nagbibigay ng pangil no, para magkaroon ng pondo at actual service in the grassroots. Yun yung wish natin na sa bawat barangay at sa bawat city, munisipyo, no, province in the Philippines ay meron ng mental health ordinances para ma-ensure natin that
Abot
everyone
kamay.
else can actually reach the services.
Yes. Later on, we also have the Universal Healthcare Act, which is parang inilagay po itong mental health in the scope of primary care. Ano po bang ine-enforce nito and what does it mean when you put mental health at a priority healthcare?
Yeah, sa totoong buhay, ang ganda nga nung Congress na yun, no? Because that particular Congress approved the Mental Health Act and actually signed the Universal Healthcare Bill into law. So, ayon sa UHC, no, mental health services are part of primary care services. So, dito natin makikita din na parang priority na pangangailangan ang mental health. And ang state actually has a merong pagtanaw, no, that mental health services are really important because it's a public health issue. At the same time, yung pag-angkla ng mental health services sa universal healthcare, no, ay importante dahil nagbukas ito ng maraming opportunities for financing katulad ng sa PhilHealth. So, meron na outpatient packages si PhilHealth. Meron din naman siyang inpatient packages for some mental health conditions, no. And definitely dahil ang mental health ay part ng UHC, so nagkaroon din tayo ng mga trainings with our professionals. Meron tayong tinatawag din na task sharing, task shifting, and yung mga other allied health professionals ay nagkaroon ng training on MHGAP, so they can also provide basic mental health services. At the same time, umusbong din yung mga training for mental health, no, dahil sa UHC. So, masabi na lang din natin, yung mga first aid trainings have become available for non-allied health individuals to learn what they can do in times of crisis. So, yung mga ganitong mga pagkakataon, ay masasabi nating the good advantages of actually having the universal healthcare law.
You mentioned earlier na ito pong nilalagay natin itong mental health as a public health issue. And these laws enforces it to have financing. And one of the things that we have now is yung nabanggit nyo nga po na meron ng PhilHealth coverage ang pag-akay dito sa mga mental health issues and even the holistic care for our mental health. Bago po natin mas pag-usapan pa kung ano po ba yung coverage, nung itsura ng coverage nito kasi marami po sa atin gaano ba kamahal, gaano ba ka parang yung scope ng budget na meron ang bawat individual. Gusto po nating malaman yung mga yun. Pero bago po yan, can you give us a general view on how much really mental health services cost? Like, for example, ang isang tao ay nag-seek ng help. Saan po nagsisimula yun at magkano yung usual range na binabayaran ng isang tao na talagang who wants to seek professional help?
Yeah, if you go to a public hospital, it can be free. It can be 100 peso, but it could be as expensive as 3,500 or even more, no? Specifically kung yung services ay kukunin natin sa more specialized na mental health professional. The thing is, we have very few mental health professionals in the country. So definitely, if the demand goes up,
Hindi na kakayanin
hindi na kakayanin mag-cater or mas lalong nagmamahal, no, yung mga serbisyo. Pag pinag-usapan naman natin yung packages ng PhilHealth, definitely sa PhilHealth accredited facilities lang ito pwedeng makuha, pero mahirap din, no, mag-seek ng support sa PhilHealth accredited facilities because everyone is requesting help from those facilities, no. So, ibig sabihin nun, pwedeng maging meron ka ng package for mental health, pero kung kakaunti lang yung facilities na available and the services are scarce, then mahihirapan yung service user na makakuha ng timely na na support, 'di ba? Dahil mahaba ang pila, marami pang naka-appointment before siya, etc. So, minsan, kung kailangan mo na talaga, mag-seek ka na ng help doon sa available, that might be a lot pricey.
Yes.
No,
And I want to pose this question, bakit po ba mahal? Bakit nga raw po mahal ang mga ganitong professional help?
Kasi there are only about 2,000 professionals sa ating population na 116 million Filipinos. Kaya ang pinagdalaban talaga namin actually, Ms. Rose, is that community-based intervention. Na sa komunidad natin, sa lipunan natin, mayroon tayong preventive measures para hindi na tayo dadating sa punto na kinakailangan pa ng mental health professional. Dahil nga po, kakaunti lang sila, definitely, na-exhaust din sila, nababurn out din yung mental health professionals, no? That workforce is really burnt out, no? Especially during the time of the pandemic. And dahil kakaunti lang sila, hindi nila kayang i-cater lahat.
And I also want to point out na yung mga mental health professionals din, some people fail to see it as healthcare in the same way as we see physical healthcare professionals. Kasi, ayun nga po, mental health is an invisible subject. Pero, kaya rin, katulad din po ng mga doktor sa ating mga physical na katawan, may ganun din silang knowledge, may ganun din silang mga various steps in their academics na nagiging dahilan kung bakit nagiging mahal ang mga serbisyo na meron sila. Contrary to people saying, kinakausap lang naman. Bakit mahal? Nag-uusap lang naman. There are various really clinical basis and also katulad ng mga doktor at saka mga professional na meron tayo sa mga primary and physical care, 'di ba? And yun nga po, meron tayo ng PhilHealth pero kapos kung titignan natin. And I like what you mentioned there na dapat magsimula sa mga komunidad in a preventive approach para hindi na umabot dun sa point, which is I think what people fail to see na effort na dapat magsimula dun sa mga katulad yung sabi nyo kanina, yung immediate is yung mga komunidad na abot kamay yung mga tulong. Other than what you've mentioned, are there any other gaps that you see with the laws that we have? May mga provision po ba na does not apply in this generation? Although 7 years pa lang din yung batas natin, medyo bata pa. But are there laws and gaps that you wish to improve more with our policies?
Yeah, in reality, Ms. Rose, no, just this December, merong bagong mental health law na napass. So, it's RA 12080. It's the promotion of mental health and well-being in basic education. So, kumbaga,
Sectoral na.
yes, may pagkilala na no na yung problema sa basic ed no ay hindi masyadong na-highlight doon sa RA 11036. And I would say that there needs to be more programs also for tertiary education and even in workplaces probably, no? That should be implemented. But meron tayong recognition that RA 11036 is the mother law. But there's also a realization na it's generalized. So, syempre, sa iba't ibang component ng buhay at sa aspeto ay iba din talaga. So, basic education is different from tertiary education. Definitely, the situations are different. And definitely, kakaiba pa rin in the workplace, di ba? Kahit pa sabihin natin na meron itong pagkaugnay-ugnay, magkakaiba pa rin siya doon sa mga different components nun.
So, much better kung targeted yung mga sector.
I would say yes, definitely. Pero it's recognizing no that it started all with RA 11036. The realization is after when we tried to implement RA 11036 and we saw the gaps. That's the realization came in.
Okay. Maganda nga po, no? Kung meron na rin tayong batas dun sa basic education po ba yun? Kasi yun nga po, andun yung formative years ng mga bata.
Yes.
And when they experience something that they are unfamiliar with, the teachers are the one who parang caters to them at the forefront.
Yeah.
And we have to have teachers who know how to handle
Yes.
when these kids experience. Yun nga po, kasi kahit silang mga bata ay unfamiliar kasi unti-unti pa lang nabubuo. And of course, we have the puberty stage where a lot of teenagers go through a lot. And if na-cater po yung mga changes na pinagdadaanan nila in a way in the education sector. And of course, I'm also speaking in the workforce sector. Andito na, although we have the HR, we have this, may mga ibang kumpanya na po ngayon na meron silang mga private companies na nagbibigay ng mga mental health wellness week. O may mga leaves po for mental health, may mga parang personal effort na ganon. But if we have the law to enforce these things.
Yeah. When it comes to the workforce, we have to recognize the efforts of DOLE also.
Oh, yes.
Kasi-
Can you tell us more about that? Kung paano po nag-integrate yung DOLE?
Yeah.
You mentioned earlier na yung DILG is part of the...
Yeah, so si DOLE actually isa sa mga unang naglabas ng department order no, encouraging private companies to actually have mental health programs.
Yes.
So, 2018 napasa si RA 11036. 2019, meron na kagad si DOLE na certain na advisory patungkol dito. And just recently, no, naglabas din sila ng labor advisory, strengthening even yung mga ways on how they can provide, companies can provide support like reasonable accommodation, etc. So si DOLE at si CSC actually also have efforts, no, to have a mentally friendly workplace. So it's really up to institutions for public institutions and private companies
To comply.
hindi ko masasabing comply but to implement, no, kasi hindi naman yun mandating but rather encouraging. So at least for DOLE, no, it's encouraging. But CSE, since they are public institution, needs to comply, no, na dapat may mga ganon. But there's a recognition na having mental health programs also require budget.
Yes.
No? So for small companies, probably they're struggling to put budget sa kanilang mental health services. But there are also some programs that they can seek help from para hindi lang sa kanila din yung burden of the mental health service. So we also have other institutions providing free programs, consultations anyway. So it's really in the matter of knowing knowing where to seek help or even tapping a bigger referral system. Parang ganun eh. Parang kailangan meron tayong recognition na meron naman mga sistema. The problem is hindi sila harmonized at this particular time. So for us who needs the help, how do we tap into these particular systems?
So in your organization, ano po yung parang how do you work with various sectors to push for these changes, push for these efforts?
Yeah. So meron kami recognition, no, na hindi kami service provider. So that's number one. But there are mental health professionals in our roster. Meron din kaming teachers, meron kaming attorneys, other professionals. But we have young people who are advocates for mental health. We also have service users, so those diagnosed with a mental health condition, and people with lived experience. So those who had mental health conditions in the past. Realizing a very diverse ng membership namin sa Youth for Mental Health Coalition, ginawa namin siyang, or we took it to our advantage, no, to build those specific networks. So, psychiatrists who are medical doctors actually, kaya din mataas yung service fee, no, kasi they studied medicine and then they went on their specialty afterwards, no, so let's give it to them. They studied a long time to actually specialize on psychiatry. So, meron kami mga psychiatrists, no, na kaibigan natin na when we need the help, actually, we need to refer those who are struggling to get mental health professional care and those who cannot afford to get mental health professional care. Meron kaming sarili po naming referral system. But above that, no, we specialize really in awareness building and even in providing credible information. Dahil ang gusto talaga naming manaig is community-based interventions. So, trying to build a mentally friendly community so we can prevent the onset of a mental health condition. Dahil din yan sa mga hinanaing din, of course, of the workforce na hindi na nila kayang mag-take in ng number of people who would need help dahil sobrang dami na nga rin. Checking also on the messaging that we provide. Malaking bagay po sa amin is yung coping, no? Kasi marami sa coping mechanism ng young people ay hindi mentally friendly. So there are risk-taking behaviors, addiction to different substances, including vaping,
Retail
drinking, Well, hindi ko masasabing masama ang ano yun, pero there are very negative coping mechanisms out there that what we're trying to educate young people with ay pwede naman natin
Healthy
tong
options.
ibahin at magkaroon ng healthy options, healthier lifestyles. No? I mean, been there, done that.
Yes.
And it's very difficult also to change our lifestyles. Kaya napaka-importante na habang bata ka pa,
Yes.
ay mas malusog na no, yung mga kaparaanan kung paano ka nagko-cope. At the same time, us in Y4MH, we do a lot on policy work. So, since we are part of the technical working groups of the Philippine Council for Mental Health, marami yung guidelines, the frameworks, different DOs, JAWs, and all that, no, na hindi lang sa national level, but also supporting yung grassroots. So, cooperating with and collaborating with local chief executives to see if the ordinances that they're trying to create ay holistic, no, yung pagtanaw sa mental health. Kasi here in our country, medyo clinical pa rin yung pagtingin sa mental health. But we have to recognize na, well, while it's a public health issue,
It's also
di lang siya
social.
clinical but also socio-economic. So, yung mga story about poverty and other stories about probably discrimination sa women, LGBTQIA+ community, etc. ay nakaangkla din, no? Sa mental health. So, yung other health components like sexual reproductive health, physical health are definitely also connected to mental health. Kaya dapat yung mga programs, services, and ordinances na ginagawa natin are holistic, no, or kumpleto yung pagtanaw sa usapin ng kalusugang pangkaisipan. Lalo na adding up doon sa mga services available during times of disasters.
Yes.
Dahil yung mental health and psychosocial support o yung tinatawag natin MHPSS ay napaka-importante in times of disasters. So, ginagawa namin ay policy work, advocacy work, bridging services, and definitely psychoeducation para din lahat tayo, no, ay pare-pareho yung pagtanaw natin sa kalusugang pangkaisipan.
Yes. This is like making do at what we have. Kasi nabanggit na po natin yung mga gaps kanina na talagang kulang yung mga mental health professionals. In terms of funding, we're not there yet na it's a priority in our funds in the national budget. But I think those efforts is like making do of what we have and what we are presented with. And we could only hope for a better world from all these actions that we do. And that's on your groups and other various similar groups actions and efforts. But when it comes to like on a personal level, can you share us can you slightly educate how people should look for help? What help do they need? Where do they go? And what are the preventive measures?
Yes, Ms. Rose, kapag titingnan natin yung tinatawag nating care pyramid, no, ang foundation nun ay self-care. Napakalaking bagay actually ng self-care na baka na-neglect natin kasi busy tayo sa work, marami tayong inaatupag, etc., etc. But it's still, kahit cliche ito at maraming beses natin na itong napakinggan, it's really self-care that matters most, no? Yung pagkalinga, pag-aruga sa sarili ang pinaka-importante to actually prevent an onset of a mental health condition. Meron tayong mental health conditions that can be passed on from one generation to another. Kaya importante din that we actually know our family history. And we go to check-ups more often. Lalo na kung meron tayong history na ganun sa pamilya para alam natin kung paano natin i-manage yun. There are also studies that actually show that micronutrient deficiency o yung kakulangan ng nutrition can actually lead to a mental health condition. So physical yun, di ba? Pero baring na-neglect natin yun because we're just eating ultra-processed foods kasi yun yung pinakamalapit, yun yung instant, yung mga chicheria mabibili mo kung saan-saan, etc. Pero yung pagkilala, no, na kinakailangan talaga natin ng healthier food options ay isang malaking bahagi din in actually taking care of our mental health. So, with that being said, siguro, we have to evaluate kamusta ba yung health ko. Isang malaking question yun, di ba? Kasama po sa health ay kung saan tayo nakatira, no? Kasi dapat malapit ka sa services. Kung sino-sino yung mga karelasyon natin. I mean, not just romantically, hindi lang sa pamilya, but also the people that we allow to be part of our lives, no? Really important din yun kasi, syempre, there are some people na nagbibigay ng toxic relationships, no? And definitely affecting mental health yun. Nandito din tayo sa mga opportunities natin for learning. Am I studying? Natapos ko ba yung pag-aaral ko? Or may opportunity ba ako to learn specific skills even outside of the school? Napaka-importante yan. Marami tayong aspeto ng buhay natin na maaaring nane-neglect lang natin sa pang-araw-araw because we're too busy. On top of that also is realizing that our emotions actually matter. Marami din sa atin siguro ang pinalaki sa mga pamilya, no, na hindi pwede magpakita ng emosyon dahil ito ay kahinaan. Lalo na sa ating mga kalalakihan na pinalaki na dapat hindi naiyak. Pero the thing is, knowing, expressing our emotions, acknowledging our emotions are part of who we are. And if we deny ourselves of that, then we are denying a part of who we are. Kaya dapat alam natin yung mga emosyon natin, alam natin kung kailan natin ito ipapakita at kung paano natin ito i-express sa mga tao sa paligid natin. But on top of that siguro, the next part of the care pyramid is informal community care. So it's realizing also that we have our responsibility sa people around us na mas maging mabait.
Yes.
Ang hirap maging mabait, Miss Rose. I mean, sa isang lugar na maraming kamunduhang problema, no? It's really difficult to be kind, no? Especially when you're struggling yourself. It's challenging to give a piece of yourself to help someone else. But if we get to live a kinder life, I think mas makakatulong
may ripple effect.
Yes, it will ripple sa mga tao sa paligid natin. That kind of aura, I think, will change how the society actually looks like. But there are also other systemic barriers, definitely. At yung corruption ay isang malaking part ng systemic na barrier na kinakailangan din natin na i-assert siguro yung ating mga karapatan in order for us to change specific systemic barriers.
Now that you've mentioned na malaking part dito yung corruption and everything that's happening around us, environment ba yan, sa panlipunan man o sa gobyerno, malaki yung magiging ambag kung aayusin ito from the side ng mga people with power.
Definitely.
Do you see mental health as a priority of the government right now?
Actually, that's a very difficult question, no? Kasi marami yung problema. Pero looking at it, when I check my social media and the news, seeing the number of, the money from the ghost projects, etc., dun ko na-realize na ang bansang Pilipinas ay hindi mahirap.
Yes.
And definitely, nakakasama ng loob, no? Kasi supposedly, yung mga perang yon na naibulsa ng kung sino-sino ay maaaring napunta na lamang, no, sa taong bayan for services that we need to protect our dignity. Yun yung mahirap doon eh. Kasi the story of corruption, nakakangit-ngit, nakakagalit, specifically because us na nag-work sa grassroots, hear stories na mga taong walang-wala, na gustong humingi ng tulong pero they cannot afford it. And then we see sa news na, ganito pala yung limpak-limpak na salapi, na supposedly, sana sa tulong na lang for this underprivileged napunta. No? If you would check the mental health budget, I don't have the specific numbers right now, but if you would check the mental health budget, definitely kakaunti ito, no, compared sa number of Filipinos actually needing support. And with a very little budget, the next question would be, how is this being allocated? So saan ba ina-allocate ito? Saan ba napupunta? The problem is we don't have a transparent spending system dito sa bansa. So we would not really know kung saan talaga napunta yung bawat sentimo na allocated for mental health. But ang pinupunta ko talaga dito, Ms. Rose, is that you have to be vigilant about this particular spending. Every cent came from the taxes of people. And I will tell you na yung corruption, no, nakakaawa yung mga matatandang nagtatrabaho tapos may tax pa. And definitely, yung mga bata na hindi covered ng PhilHealth, saan sila hihingi ng tulong. And the money na nakurakot supposedly is their way, no, to actually maintain their mental wellness. Pero hindi kasi ganun yung nangyari.
And I would agree, that it's really hard to answer that question. Kasi if we're going to look at how much a disaster could affect a certain community, but at yun na mismo hindi nila inisip na this whole community will suffer if that flood control project is not well executed or yung sa substandard siya. If they cannot care about that, how much more they could care about the individual mental
Yun na
health
nga
of each
po.
people.
Parang yung tanong doon would be, ano ba talaga yung nagmamatter sa duty bearer?
Yes. And right now, I think we're seeing, ang hirap tignan kung public service pa ba yung nakikita natin with the government that we have now. But on the, switching back, do we still see legislators who are giving attention to this subject? Meron
Yes,
pa bang
naman
mga natitirang iilan that we could put our hopes on?
Yes. Ako talaga hindi ako nawawalan ng pag-asa, no, sa usapin patungkol sa health, no, because there are duty bearers who are in position, authorities right now, who are advocating for health-friendly policies and even programming. So ako yung sa akin talaga is not just sa ating legislators but the heads of local government units, the heads of national agencies. Doon tayo nagkakatalo-talo, I think, sa ano bang priority nila. How are they serving the people? Would be the question. At the same time, siguro gusto kong mag-touch base doon sa ideya ng yung budgets ba that or the systems ba na nabudgetan ng ating taxes actually serve the people. Kasi may question pa rin about appropriateness of different programs and services, di ba?
Hindi na akma.
Na
yung
baka
ibang
hindi
programa.
akma. Exactly.
Kung hindi man akma, hindi naman nakakarating sa mga constituents or sa mga subject dapat na sinaserve ng mismong mga programa.
Kaya sa palagay ko parang dapat pa rin tayong tingnan din natin siya sa bibingka na approach talaga. Realizing that consulting the people ay mahalaga, no? For us to know if the services, the programs, the facilities, the infrastructures that we built are actually appropriate, no? And they address the needs of the people. Kasi minsan hindi na, no? Let's see to it, no, that the system wouldn't fail us, because right now the system is failing us.
And especially in the discussions of mental health, it changes.
Yeah,
like now
it evolves.
we are, just like what you mentioned earlier, we started from it not being talked about to it as a taboo, and now slightly discussed, but it changes. So if we're going to focus on policies,
Yeah.
it has to be appropriated, lalo na ang generation ng behavior ng mga kabataan ngayon, who will later be the adults, are fast, like, there's a rapid
Mabilis na,
change with
no?
the behaviors that the children are showing now. And yes, I think gusto ko lang din balikan na, just like also your organization who works with policies, mahalaga talaga na may mga datos tayo na nanggaling dito sa Pilipinas, yung konteksto ay nasa
Yes.
Pilipinas. Because I think I've discussed with some mental health advocates and they're still parang capitalizing on data
Western.
from Western or international data. Mahalaga po na nasa yung konteksto na parang kung saan nakasandig yung mga batas
Yes.
natin Nandito.
nasa konteksto ng
Yes.
Pilipino. Agree ako sa'yo doon. Kaya naman yung panawagan talaga namin, no, magkaroon pa sana ng more studies and even targeted studies, no, para mas maintindihan natin yung socio-economic and even commercial determinants of health na nag-influence, no, sa mental health landscape natin sa bansa. At the same time, siguro, hindi lang siya for research institutions, no? But actually, even the academe can do that, no? I mean, they can influence their students to work on that sa research nila. Sa palagay ko naman, meron naman mga academic institutions who are actually doing it. Pero sharing it to the broader audience probably would be more helpful. And syempre, sa ating local chief executives din, because we have profiling din naman, no, ng mga miyembro ng komunidad. So the information that you get from your profiling is very important na it's being reported and even collated, no, para magkaroon tayo ng bigger point of view, no, when it comes to mental health.
So, Miss Aliana, if we don't take this seriously, mental health, what are we facing here?
Ako personally, if we don't take this seriously, no, then there would be economic problems later on. I would say that. Yung population natin, yung young population natin ngayon would be the workforce later on. And if during their younger years, they are not able to manage their mental wellness because the society and the system didn't allow them, then definitely mag-reflect ito sa performance nila later on when they are part of the workforce. And if we have a workforce na hindi nagpa-function, then meron siyang economic barriers later on. Realizing also, no, na nakaangkla din yung mental health natin, hindi lang sa ekonomiya, but also new opportunities moving forward, probably on technology and all that, and even AI. Napaka-importante na pagtuunan natin to ng pansin para ma-realize natin that when we nurture the mental well-being of our Filipinos now, there are more opportunities for advancement in the future.
So, Miss Aliana, I would like to ask you for the last time, ano pong mensahe ang may bibigay niyo to all these people struggling in silence? Any encouragement and message of availability of help?
Sige po, para po sa ating mga kababayan, no, na nagsa-struggle sa kanilang mental health, gusto kong malaman nyo na proud ako sa inyo because you wake up every day really wanting to live and wanting to overcome the challenges that you have. And that particular want is an actual strength. And siguro, isa itong panawagan din sa mga Pilipino, no, na maintindihan natin, no, na ang ating kalusugang pangkaisipan ay isang importanteng bahagi ng ating buhay. Merong mga serbisyong available, merong mga taong nakapaligid sa atin na maaari din nating hingan ng tulong. But the biggest thing about mental health is that we can help ourselves. Kaya naman, suriin natin, no, yung ating estado, yung ating kalagayan at this particular time, and find ways, no, where to seek help. And if you would need to learn more about mental health, definitely ang Youth for Mental Health Coalition is here to actually provide you with information that you need to understand this particular concern better. At the same time, there are other mental health organizations that can provide us with services and information, and even the Philippine Council for Mental Health is available to provide you with information that you need. Siguro bilang panghuli, no, ang mental health ay isang bahagi, positibong bahagi ng ating mga buhay. Let's not neglect it. No? Pangalagaan natin ang ating mga sarili, magbigay tayo ng tulong sa mga taong nangangailangan, no, sa ating paligid. And syempre, let's fight for our right to health and right to mental health. So, let's hold our duty bearers accountable. Katulad ng lagi naming sinasabi, lagi nating tandaan, ako, ikaw, tayong lahat ay mahalaga lagit-lagi, kaya pangalagaan po natin ang ating kalusugang pangkaisipan.
Maraming salamat po, Miss Aliana, for
Thank you.
making this discussion insightful and educating us on this subject. Thank you so much po.
Salamat po, Ms. Rose.
And that has been Ms. Ray Aliana Lagasca, National Chairperson of Youth for Mental Health Coalition. Sa aming mga manonood, bukas po ang ilang organisasyon at institusyon online man o ang kani-kanilang mga tanggapan para tumugon, sumaklolo o kausapin kayo. Makikita niyo po sa screen ang ilang mga emergency hotlines at mga grupo o samahan handa kayong tulungan. Help is available. Muli ako po si Rose Babiera. Samahan niyo akong muli sa susunod na linggo para pakinggan ang iba't ibang boses, mga kwento mula sa iba't ibang anggulo. Dito lang sa Point of View.